With lactose intolerance due to lactase deficiency, undigested lactose reaches the colon where bacteria ferment it. This creates gas and osmotic diarrhea. Symptoms often include bloating, cramping, and urgency of stool. Patients may attribute this to a food sensitivity, but it's actually carbohydrate maldigestion, not an immune reaction. So this test is used when lactose intolerance is suspected, especially in adults with new GI symptoms or infants who fail to thrive. It's important to note that this is not the same as the lactulose test. Here we are assessing the digestive enzyme lactase, not gut permeability. A high lactose load will challenge the system. If lactase is deficient, symptoms will appear rapidly. Prior to testing, we take a fasting blood glucose level. If the patient then will consume 100 grams of lactose, and we check blood glucose at 30, 60, and 120 minutes. The patient, if they have adequate lactose will break down into glucose and galactose. If lactose breaks down into glucose and galactose, we will see a normal blood glucose rising and falling appropriately. If glucose does not rise and symptoms appear, that supports lactase deficiency. This test can be hard on patients because it intentionally is provoking their symptoms. So here's how we interpret normal results or any results. Normal digestion produces a rise in blood glucose of more than 20 milligrams per deciliter without any gut symptoms. In lactase insufficiency, the lactose is not digested into glucose and galactose. Therefore, blood glucose does not rise. Symptoms appear as gas, bloating, and diarrhea. Another pattern could be endogenous diarrhea, where lactose breaks down normally, but glucose isn't absorbed due to malabsorption. And in that case, blood glucose still fails to rise. So we would follow up here with a D-xylose or an intestinal permeability test. The hydrogen breath test is a less invasive and generally better tolerated test after fasting. Baseline breath hydrogen is obtained. The patient ingests lactose then. Breath samples are collected over 2 to 4 hours, and if lactose isn't digested, colonic bacteria ferment it, which releases hydrogen and methane that then diffuses into the bloodstream and is exhaled. This test will capture real-time fermentation activity and correlates directly with symptoms. And we can kind of see this here. If we're looking at the test, an increase in less than 10 ppm of hydrogen from baseline is desirable. A rise of more than 20 ppm indicates lactose malabsorption. Symptoms accompanying the rise, like gas, bloating, or diarrhea, reinforce the diagnosis. And this approach identifies true lactase deficiency without the discomfort of a blood test high lactose challenge. This is showing our hydrogen increasing over time relative to ingestion. And the main learning point is that hydrogen production correlates with fermentation occurring in the colon, not the stomach or the small intestine. It peaks at the wrong time, could suggest other conditions like SIBO, which we are going to transition into next. So to kind of summarize what we previously talked about, um, going back here, our blood glucose test measures the digestion and absorption, and the breath test measures fermentation and gas production. Clinically, the breath test is more comfortable and avoids provoking severe symptoms. If results are unclear, pairing it with a D-xylose or intestinal permeability test can reveal whether lactase deficiency is primary or secondary to mucosal injury.